Dr. Sajid here again. We're continuing our talks about vitamins, and today we're going to tackle another important one, which is vitamin D. And it is often in the news because recently people claim that it is a cure for COVID. So vitamin D is nevertheless important. We'll talk about what is it and where do we get it from. Why do we get deficiency, and if we do, what are the symptoms and how do we recognize it, and also we'll talk about how to treat it, and of course what is the best way to prevent it. So let's begin by explaining to you that vitamin D, just like vitamin A, is very important for the health and well-being of children as well as grown-ups, and it is one of the essential vitamins, like I have explained before in one of my video clips. So what vitamin D belongs to the group of fat-soluble vitamins, and the others are A, E, and K. Now, as opposed to vitamin A, there is no source from plants. It's not available in plants, but nature has made provision for vitamin D production from our skin. So skin exposure to sun causes production or increases the production of vitamin D. Also, it is present in some foods, but mostly animal origin. Most abundant is, of course, in fish that are fatty, and it is present in some meat organs, and is also present in egg yolk. Now, as you can imagine, these foods are generally not sufficient in most children's diets, and therefore a deficiency can occur. And the second source I've explained is the sun. So if the child does not get enough exposure to the sun, or does not play outside, or lives in very dark and crowded conditions like in some of our cities, then the deficiency of vitamin D can develop. So if there is deficiency of vitamin D and it affects children more, and then it also affects the elderly, it can have effect on mostly the bones. The teeth may be affected, the bones may become somewhat brittle, as we call them, and there may be bowing of the legs. The head shape becomes different. The frontal part of the head becomes large, and the child may also have not only delayed dentition, but would have delayed walking and is generally considered weak. Vitamin D is also important for immunity, and therefore babies who are not getting enough vitamin D will become prone to more infections generally. Now, it is also considered an important vitamin for other conditions, for example, heart conditions, for allergies, for diabetes, and people or children who are obese will have difficulties with vitamin D. Whether it is essential for COVID-19 or not, but I can assure you that it is very important for a child as well as a grown-up to have adequate amounts of vitamin D, which will ensure proper immunity, which will then prevent infections of this kind from occurring. So people talk about its effectivity in preventing cancer and in avoiding allergies. So these are open to debate, but it is a very, very important and useful vitamin. So how do we cure it? It's very simple. We replace it with vitamin D, which comes in different forms, some in injections, which can be either taken as an injection or taken by mouth, and of course in drops. I may want to mention here that it is very important for little babies, and breast milk, as complete as it is deficient in vitamin D, and babies who are in the first 6 months of life, especially those who are breastfed or taking less than 1 liter of milk in the form of formula, less than a liter per day, must be supplemented with vitamin D. The other sources are when the child gets older, then some of the milks are fortified. So if there is a deficiency, we should consult the doctor, and they will give you larger doses. Larger doses may be required in older ages also. If there is a problem with the child where there is malabsorption from the intestine or intestinal problems, the child may also require extra doses of vitamin D. But it is replaceable, and it is very simple to treat. So I have explained that a deficiency can occur. The treatment is rather simple, and rather than suffer from the consequences of vitamin D deficiency, as always, my suggestion would be to make sure that you can prevent it, and prevent it by having adequate sources of vitamin D. I may point out right at the end that despite all the sun that we have in our country, the exposure that we require is to be much larger than the 10 or 15 minutes per day that is recommended for the lighter skins. And the reason we may have more deficiency is because of the high levels of pollution that are present in our environment, and that is one of the reasons why we are more deficient in vitamin D than some other cultures. Also, the skin color has an effect on the production of vitamin D. The darker skins take a lot longer to get the appropriate amounts of vitamin D. So try and prevent it. Try to get a child to eat the kinds of foods that I've mentioned, and let him be exposed to the sun when it is safe and when it is possible. This way you will prevent vitamin D deficiency and keep your child in good health. I hope this information has been of some use to you, and I will continue talking about other vitamins in the coming clips.